Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Dr. Muhammad Al-Shif, your host for Elixir of Life, live from Saudi TV, Channel 2. Our topic this week is very important, is weight loss surgery. However, we have many inventive and interesting segments. Without further ado, we'll go for a break. Stay with us. Now we'll go for the quote of the week. Please watch this report. Stay with us. Once again, welcome back to Elixir of Life. Our next segment will be medical news. We'll start by a report about preventing venous thromboembolism conference. Please see more details in this report. Stay with us.
I'm Dr. Al-Asiri, the Medical Director of KMC. I'm a radiation oncologist, working KMC since 2010, and I'm the patron for this event today.
Please tell our viewers about this event.
You know, thrombosis in medicine is one of the major problems that we face in hospitals, especially for admitted patients. You know, when the patients stay in the bed for a long time, or pregnant ladies, or patients with pelvic pathology or pelvic fractures, or any fracture in the body, or patient came for delivery after pregnancy, there is instance of thrombosis. Thrombosis is a clot in the veins, and this clot may move from whatever it started towards the lung or any major organ and cause problems, sometimes cause death. So there is a lot of research and maneuvers to prevent this from happening, because prevention is better than treatment. And this is what we're doing now. So the patient at high risk of this problem, which is thrombosis, they start to be medicated either on oral medication or subcutaneous medication to prevent the thrombosis from happening. But this is one part. The other part, to treat the disease when it starts. For example, the patient get pulmonary embolism, which is a clot in the lung, so the patient will not breathe normally and they have difficulty in breathing. So this event especially for the prophylaxis. Prophylaxis means that we try to prevent the thrombosis before it happens. There's a lot of people who are at risk of thrombosis. Example of this, smoker. They are at high risk of thrombosis. Obese people, anybody who's obese is at high risk of thrombosis. Patient with varicose veins, patient with previous thrombosis in the past, all patients with cancer, all of those patients, they are at high risk of thrombosis. So those patients, when they come to the hospital, we have to start educating them to prevent the thrombosis event from happening. Alhamdulillah, King Fahd Medical City is the leading institution in Saudi Arabia for this. We have 3 consultants specialized in thrombosis medicine. And as you can see, there is a lot of activities here. All these posters, they are a product of our staff, medical student, consultant, researcher, therapist, technologist. All of them, they participate in research. And we start collecting data about the incidence of thrombosis in the hospital. And we play a major role in the national thrombosis guidelines in Saudi Arabia. I hope by gathering people in this event, we will educate more staff, especially junior staff, medical students, nurses, and other technologists working in hospital, and our target to reduce the thrombosis event in any hospital.
Mukhtar Umar, clinical pharmacist, graduated from the residency program from Saudi Council. Regarding this event, our role as a pharmacist, so we are explaining our role of clinical pharmacist anticoagulation in clinic. Basically, this is our role in this event. So explaining more of the medications, the new oral anticoagulants, what's the role of the new oral anticoagulants in the treatment of venous thromboembolism. This is mainly our role as a pharmacist in this event. And this event, you see that multidisciplinary, physician, nurse, radiographic, and all the health educator that's involved in this event.
What do you suggest to prevent from this disease?
Moving. This is basically the only prevention for normal people. But for that we have a certain program that's to prevent venous thromboembolism in the hospital, inside the hospital, and even outside the hospital. We have different programs, different recommendations to prevent thromboembolism.
Hello, welcome back to Elixir of Life. Our next segment of medical news will be 5th annual meeting of the developments in ultrasound imaging. Let's see more details on this report. Please stay with us. Don't go away.
My name is Ghassan Abu Tarbush. I'm from King Khalid University Hospital. I'm the ultrasound supervisor there, and I'm an ultrasound specialist. The event is for the sonographer, as a sonographer day. We know we are planning to do an ultrasound group. Their concerns is to teach people how to do ultrasound, the risk about doing ultrasounds, and we're trying to educate everyone about ultrasound and tell people what the ultrasonographers are doing now. Ultrasound is one of the specialties that is growing, so fast. Our main goal is to tell people about ultrasound and about, the huge upgrading in ultrasound machines and so.
Today we are in the 5th update in ultrasound at National Guard Hospital, King Abdulaziz Medical City, and this event is hosted by the National Guard and in conjunction with the new Saudi sonography group. And in this day we are just going to list all the ultrasound new updating the sonographers, updating the health workers in the careers about the ultrasound in different stages and different subspecialties, especially for obstetric, gynae, in anesthesia, the role of ultrasound in ophthalmology, and musculoskeletal injuries, etc. In this day, we dedicated this day actually for the sonographers because they are widely spread in Saudi Arabia, and they have a lot of very vital role in ultrasound diagnosis and screening of some disease, also in reporting the ultrasounds, which helps usually the physician, referral physician, in treatment, in diagnosis, and follow up some cases after a while. So this day is updating the ultrasound in general, beside the celebrating the first joining gathering all sonographers in Saudi Arabia and in Gulf City. We have a big group coming also from different areas from outside Riyadh. This event for the patient is good for them. If you are going to go to any ultrasound department, you will need to have the competent sonographers, that you are going to go there inside the rooms to be 100% sure that the sonographer will be doing or performing the ultrasound with very high performance, skills, knowledge. These events usually providing these sonographers with the sonologists, sometimes technicians who is working in ultrasound department, about updating, so they are fully aware about what is coming in the future, about the new technologies and modalities inside the institution, in their institution and outside, what is also some guidelines, new guidelines and protocols can be adopted from internationally or nationally. And so the patient, for sure, she will be like 100% sure that she's going to be scanned correct way and good report also, and not to miss that day and to go to another days.
Hello, welcome back to Elixir of Life. Our next segment will be health, myth and fact, and we'll talk about a very important fat-free and low-fat foods are always healthier than full-fat varieties. Let's see more details in this report. Please stay with us. Hello, welcome back to Elixir of Life. Now we are coming to the most important segment, which is episode theme, weight loss surgery. Obesity is increasing in the Saudi population with an overall prevalence of 35%. It is a major risk factor for several important diseases, especially heart attack, diabetes, hypertension, cancer. It increases morbidity and mortality with significant impact on quality of life and life expectancy in different societies worldwide. Obesity is attributed to excessive food intake and lack of physical activity, and that are the main reasons. We will talk about weight loss surgery or bariatric surgery, and it's our honor and pleasure to present Dr.Naif العنزي. He's a consultant bariatric surgeon. Welcome, Dr. Naif, to our program.
Thank you very much. It's my pleasure to be here with you today.
Okay. Without further ado, we'll go. We have so many questions. It's a very interesting topic. I'm sure many viewers waiting for this episode. Is obesity a real medical problem in our society, Saudi Arabia?
That's true. Obesity is increasing in the last decades in Saudi Arabia and the Gulf region as well. It comes more obvious that most of the people, they are getting between overweight and obese. There is recent studies that showed that Saudi Arabia is ranked as sixth to seventh country overwhelmed with obesity. People, they are thinking that obesity is a cosmetic, but in reality it's one of the diseases that can cause a lot of medical problems. As you mentioned, that diabetes, hypertension, and hypercholesteremia, in female infertility, polycystic ovary. So a lot of diseases that can be caused by obesity per se. We cannot mention that nowadays it's like 70% of the population in Saudi Arabia that they are suffering from obesity.
70%.
70%. So dividing between like 30% and or 32% men, and the majority are female and a woman. It's counting like 30 plus 37, 36. Nowadays we can say it's a disease and it should be treated.
Mm-hmm. How, Dr. Naif, how we define obesity? Is there any scientific definition?
There is many ways to define obesity. Either to go with the regular definition of obesity, that it's an accumulation of excess fat in the body that accumulated in unusual way. Some definitions that may say that it's more than 30% increasing in the body fat, but another definition is saying that it's imbalance between the calories intake and the calories is getting burned. So, and there is a lot of ways how to measure that obesity.
But body mass index is the most commonly used method.
That's true. The body mass index is the standard now to measure who's obese and who's not obese, and who's overweight and who's is normal weight. That if we go, what is body mass index? People most of the time they're asking, for example, my patient, they're asking, doctor, what's my body mass index? It's a simple calculation, is that we are dividing the weight over the by kg over the height square.
Meter square.
Yeah, meter square. Normally, or the normal BMI is less than 25. Between 25 to 30, we are considered as overweight. From 30 to 35 is obesity class 1. 35 to 40 is obesity class 2, and more than 40 is class 3.
Or morbid obesity.
Or morbid obesity. Yeah, there is. We are saying like nowadays it's class 1, 2, 3, or saying like obese, morbid obese, super obese. It's the same definition.
Same definition.
Yeah.
I think this leading us to our topic. Who is candidate for weight loss surgery or bariatric surgery?
Based on the guidelines that comes from American Society of Bariatric Surgery, or from the IFSO, the International Federation of Bariatric Surgery, they define the needs, who's going for bariatric surgery, who's not eligible to go. There is a criteria. One of these criteria is patient should be an age-wise between 16 to 60. Sometimes we are reaching 65. Patient who is staying for minimum 2 to 3 years on dieting and exercising, and he failed to lose weight. 3, patient who is not suffering from any psychiatric problems or alcohol addict. 4th, which is most important, anyone who is more than BMI more than 35 with comorbidities like hypertension, diabetes, hypercholesterolemia, or BMI more than 40 regardless of comorbidities. So it's 5 conditions that we can select patient as a criteria to go for bariatric surgery.
That's very interesting. How do a person know if he's a candidate for bariatric surgery?
That's what I'm saying. We are measuring the BMI. BMI is the most parameter that can indicate who's going for bariatric surgery, who's not. Actually, nowadays with the social media, people, they are seeking the medical advice through the social media, just giving the BMI and saying that that's my BMI, I need to go for surgery, which is wrong. Patient needs to come to the clinic to be assessed by the surgeon, taking a history, physical examination, laboratory-wise, to determine, is it an obesity, or is it due to some problems like hormone changes or medications. So I think that coming to the clinic and assessed by the surgeon is very important, plus what we are saying, that the parameter of BMI.
Excellent, very interesting. What's the difference between bariatric surgery and plastic surgery like liposuction, etc.?
I think this is complete. There is no comparison between the two kind of procedures. Bariatric surgery is, we need to lose, to get rid of the weight by either, there is 2 ways, either with going with the restrictive measure, like doing a gastric band or sleeve gastrectomy, or to go with restrictive and malabsorptive way, which is going with the gastric bypass and mini gastric bypass or duodenal switch. So by any one of those procedures is a bariatric surgery. But if we go to the plastic surgery is something different, because we are treating the fat. That's mean the subcutaneous fat. We are not treating the main cause of that that causing the fat, subcutaneous fat. So if you go, if the patient is obese and going to a plastic surgeon, what he's gonna do is just taking the fat in the subcutaneous area, and patient that feels he's okay and he's nice and looks, the shape is very elegant, but he will discover that in a 6-month period of time he will regain again, or that fat is already out, so he's accumulating another fat. So we don't reach the source of that fat which is inside the abdomen, that can be increased by food and calories.
Yeah, I think that's important, Dr. Naif. The liposuction, they are targeting the fat beneath the skin. What about the other, the inside the abdominal viscera, the intestine, the liver, fat liver? So can you just shed more light about this?
Yeah, because the main source of the fat that in the subcutaneous area is the fat coming from inside. So when the patient is eating much and the calories increase, that means accumulating of fat cells that disposed mainly in the omentum area, which is surrounding the stomach and surrounding the intestine. That will lead to increasing getting absorbed and increasing the circulation, and will be appear in the shape of the patient outside. So then the fat will be deposited in the subcutaneous area, either in the tummy or the upper limb or lower limb. So taking that fat out is not solving the problem, because in a 6 month that fat will be accumulating again. So we have to attack the source of that fat by either, as I said, it's the stomach at the end. So we need to change the shape of the stomach by decreasing the food or getting the patient who's eating much by malabsorptive procedure.
We say there is a hadith Nabawi that the stomach is the home of diseases.
Yeah, exactly.
And diet is the best medicine.
Yeah, that's true. You know, a lot of things that can happen. People, we are eating. So by eating, we can increase diabetes, we can increase hypertension, we can increase the cholesterol, we can increase the fat inside the abdomen, we can increase the risk of ulcers. So a lot of things can be increasing, getting by eating the food. So the healthy food can let the people to survive in a healthy and nice health status.
I think diet is very important for any patient going for weight loss surgery, either before or after. I think diet and exercise are the mainstay of therapy as initial therapy. If diet and exercise and medical therapy failed, then surgery is the only available option. Is it true, Dr. Naif?
Usually, always I'm saying to my patient that surgery is not the first choice. Surgery comes when the patient failed to do regular exercise, failed to do dieting for a long period of time. When someone who's staying for like minimum 2 years, he's doing dieting and exercise and he cannot get committed to that, or losing weight, then after a while he's increasing his weight, then he can go for surgery. At that time the surgery is the last chance for him. But we need to mention that, and people they need to understand that bariatric surgery is a supportive. It's not a treatment for obesity. What does that mean? I can say it in different way. It's a kind of diet, but it's something like a very strong diet, because if he's dieting for like a week and he went with his friend to eat, so they're gonna increase that, or disturb the diet that he made. But if he did the surgery and he start to eat, either he will have abdominal pain or he will vomit. So he will be scared not to touch the food. And he at that time he will be follow the orders. So bariatric surgery is a kind of procedure that allow patient to get the benefit of decreasing the food and get the benefit of doing exercise. And when they do the exercise, they will lose weight faster than the diet alone. And there is a few studies that shows dieting alone or exercising alone is decreasing by 6 to 9%, while if the bariatric surgery is doing the major weight loss by reaching like 50 to 70% of the weight loss. So the other point that when patients they are saying that what's the benefit if I did the surgery and after a while I get obese? See, now we need to understand that bariatric surgery is a supportive, means that needs to change. You need to change your lifestyle. You need to change your behavior. If you are not willing to do those things, so please don't touch it. Be away from bariatric surgery because it's gonna be failed in 2 years. So then you're gonna blame the surgeon. You're gonna blame the surgery. You're gonna look for another kind of surgery or procedure, which is not right. I don't recommend it. So I receive patients. They are coming for in my clinic. They are saying, okay, in 2 years I did the surgery like for the last 7 years or 6 years, but the surgery is bad. Why? Then I told him, look, if you are searching for another procedure, this is wrong. I can convince you by that this kind of surgery, for example, sleeve gastrectomy, if you are now, you were before surgery, preoperatively, your weight was like 150 and you reach up to 80, then you are gaining again, that's means the surgery is perfect. It's working, it's functioning. So if you came again, that's means the problem from you, not the surgery.
The diet after.
Yeah, exactly. They are not following. So then I tell them, okay, go back to the dietitian, go back to your exercise. I'm sure in 3 months you're gonna be back to your ideal weight.
Excellent, very interesting, Dr. Naif. Now we have a phone call from Miss Lina. She's a clinical dietitian. Hello, Miss Lina.
Hello.
Assalamu alaikum. We are just, talking about the importance of diet after bariatric surgery. Can you elaborate more on this, Miss Lina?
Yeah, for sure. First of all, I would like to thank you for your invitation. Actually, in the weeks after surgery, the surgeon and dietitians, they will have a plan for the patient to follow, including instruction for nutrition and activity. It is important to follow the recommended guidelines to prevent complications and ensure success. Physical activity is very important for long-term weight management. Follow with your surgeon about this. He will guide you at which time to start and which type of physical activity to do. From dietitian side, we are focusing on some points like progression of the diet. We start with sips of water about after 24 hours from the surgery, clear liquid, full liquid, pureed diet, soft diet, and this progression I mentioned will consist of healthy and natural food. Also, the patients will need a lifelong habit with daily supplements, usually including multivitamins and some vitamins when it is deficient, like vitamin D and vitamin B12. Protein supplements, especially whey protein, should be taken in multiple doses, starting from full liquid diet to avoid muscle wasting. Also, caffeinated beverage should be avoided because we are focusing on hydration status. Caffeine is diuretic and it is not beneficial in bariatric patient situations. Sugary and fatty food also should be prevented at all to avoid dumping syndrome and weight gain. Always, I advise my patient to don't forget to eat several small meals. Stop eating when they are feel full. Eat slowly and truly chew food. Finally, as Dr. Naif said, it doesn't mean the size for the stomach is small, it is forever. So if the patient will not follow the dietitian and the surgeon's instruction, he will be obese again.
Thank you, Ms. Lina. Thank you very much. It was very enlightening. And
for you.
See you again, inshallah. Now we'll go for most important topic, now going deeper and deeper. What are the options of bariatric surgery or types of bariatric surgery?
Yeah, as I mentioned in my talk first, there is two categories for bariatric surgery or bariatric procedures, either to go with a restrictive like sleeve gastrectomies and gastric band, or to go with the restrictive and malabsorptive procedures like gastric bypass and duodenal switch. At the beginning, gastric bypass was one of the top procedures worldwide. Nowadays it's coming down, and the sleeve gastrectomy start to be the more popular and demanded by patients for a lot of reasons. One of those reasons are it's simple, fast, easy. There is no change in the anatomy of the abdomen. Procedure can be done with the laparoscopic without any problems. There is no demand on medication. Patient don't need to stay on medication for a long period of time. Complication rate is less than comparing to other kind of procedures.
So what are the most important complications for gastric or sleeve gastrectomy?
Sleeve gastrectomy is as any of other procedures, surgical procedures, but there is a specific complications for this kind of procedure. One of these complications is the most worried part from either from surgeon or from patient. They are specifically asking about this is the leak. When the leak happens, but the worldwide figure for that leak is less than 1%, which is coming down, starting with like 6 or 7%, and now it's coming with the new technologies, with the new with the skillful surgeons, coming down to less than 1%. The other one is bleeding considered as less than 1% as well, and the third one is thrombosis or deep vein thrombosis or pulmonary embolism, and the percentage is less than 0.5%.
Yes, Dr.Naif, the rate of complications is very low if done under expert hands. That's important.
That's true. Yeah. I can stress on this point actually. Nowadays anyone can say that I'm doing a bariatric surgery, and I don't think this is the right practice to be carried out, and people now it's more educated, and patients they are not taking these things lightly like previous years, and I think if we define what's the meaning of skillful surgeon or qualified, that means that surgeon he's carrying a fellowship in bariatric surgery specifically, because nowadays it's for the last I think 7 or 8 years or 10 years maybe there is bariatric surgery subspecialty, especially in North America and Australia. So a surgeon who's taking his fellowship in 1 year minimum, to someone who's trained with skillful hand, who's had fellowship in bariatric surgery and in a close relation with that surgeon, so he's doing that surgery under his supervision for a long period of time. The practice nowadays, some of surgeons they are just taking like courses in bariatric surgery and comes and they are saying we are a bariatric surgeon, and this is I think not right, and should be restricted for only the skillful surgeons and qualified surgeons.
I think Dr. Naif, you highlighted very important point. I think this is the patient right to ask the surgeon his qualifications, because as you mentioned, many people are not subspecialized in bariatric surgery, maybe general surgeon, but they are doing bariatric surgery. I think this is a patient right to ask the qualification and should be done under expert hands to minimize the complications rate. You mentioned thrombosis or blood clots after bariatric surgery is one of the expected complications, but that's why patients should receive medications like heparin to prevent blood clots, especially for 2 to 4 weeks. What about blood clots in the portal vein or the abdominal veins, portal, mesenteric? Do you see it commonly, or this is a rare complication? And is it more with the sleeve gastrectomy or the bypass or there is no difference?
As one of the complications, pulmonary embolism and deep vein thrombosis, it's a well-known complication to any kind of surgery.
Yes.
Since the patient can receive a general anesthesia, so this kind of complication can happen.
Exactly.
But why it's increased with in bariatric surgery? There is two reasons for that. First of all, the obesity, one of the causes, can lead to thrombosis. Two, the prolongation of the operation time. Patient is completely anesthetized and obese, staying on a bed, no move for like 2 or 3 hours, depending on the surgery. So this kind of two risk factors can lead to thrombosis. That's why we are preventing this by giving the patient heparinization before surgery as a single dose, and after surgery we are starting the heparin prophylactic doses till the patient getting discharged. After discharge, he can continue on Elixir for a period of like a week or two. This is, I think, depend on the surgeon himself and his preference. Myself, for me, I classified depending on the BMI. If the BMI less than 50, I give it like for 7 to 10 days. More than 50, staying for 2 weeks or 3 weeks, depending on the situation of the patient.
Elixir is kind of low molecular heparin, kind of heparin.
Yes. For the other question that, sorry.
Yeah, why we have more abdominal vein thrombosis?
Yeah, it's not very common with the sleeve gastrectomy, but actually I start to see that kind of complication since I came like a year ago, and I saw like 3 cases. Most likely it's due to dehydration.
Okay.
So when the patient gets dehydrated, he gets the thrombosis. Treatment is very easy. The most important is the time when the patient discovers that, or the physician discovers that thrombosis. Because if the thrombosis discovered late, it will lead to bowel ischemia. So we'll end it with a bowel resection and the sequence of bowel ischemia. But if it discovered earlier, at the beginning, so the treatment is very simple: hydration, 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 anticoagulant. That's it.
Excellent. Dr. Naif, can you explain more in the stomach the way you do partial gastrectomy or sleeve gastrectomy?
So let me just elaborate here more.
Great.
So let's assuming this is the abdomen. Okay. So this is the diaphragm from the side. Here's the stomach. So always I'm saying to my patients that why we need to keep the patient on a pre-operative diet before surgery. For I don't want to lose the patient to lose weight, and he's saying that no, if I need to lose it, why I should come to do bariatric surgery? He's right. The aim of that, if you see how the liver is covering the stomach, so by this, if I need to do the sleeve gastrectomy and cutting the stomach, reaching up, I need to elevate the liver.
Excellent, very important.
So if the liver is having fatty liver means that the huge liver covering the stomach and sometimes covering the spleen. So if it comes like this, so I cannot do it.
Excellent.
So because I need to elevate the liver to be able to cut the stomach. When it's very small or shrinked or to the normal size, that will be much easier, so I can cut the stomach. So stomach is like this, okay? So when I go up, when I go up, starting from this, first of all, we'll cut the omentum, which is the fat is attached to the stomach. We'll cut it from this side. So usually I start like 5 centimeters from the pylorus. Here's the pylorus. Here's the esophagus. So we'll cut like starting 5 centimeters. Then we'll cut, if you see this yellow line, this is the fat. So we'll cut it from here all the way to go up. This is number 1. 2, the same, I will come as a 5 centimeter or 6 centimeters from the pylorus and cutting the stomach vertically till reaching the junction between the stomach and esophagus. The most important thing here in this area is to take the area which is called the fundus, and where it's containing the ghrelin hormone. What's the aim of not taking the ghrelin hormone? Patient will stay having a satiety, and he wants to eat more and more. Cutting that area, or the cells containing, secreting the hormone, that means leads to a patient will have prolonged satiety, and he will not feel that he's hunger. So he's staying like for like 10 hours. He doesn't like to eat. So this is the aim of the surgery. So cutting this area vertically till the, as I said, 5 centimeters from the pylorus. So it will come as a banana shape after that. Very small. That the remaining of the stomach is taking only 100 to 120 ml. Just imagine someone who's taking like 5 or 6 kilo, and all of a sudden he will only taking 100 to 120 ml, and he will be satisfied.
Okay.
By that, by this measure, he will the first week he will reduce, like he will go down with the weight like 5 kg. He will lost it. Very simple, without doing anything. So so this is basically the procedure.
Excellent. Doctor, what about the expected weight loss? Is there any risk of drastic or rapid weight loss for this patient?
Yeah, if you go with the sleeve gastrectomy, usually the weight loss is around 60 to 70% of the excess weight. So let's assuming that someone whose his height is 160 and his weight is like 150. So if we assume his weight, the ideal weight will be like 60. That means he has like 90 kg extra. So he will lose 70% of the 90 kg. Over a period of like a year and a half. But some people they reach that by like 9 months. Why? Because they are following the orders and obeying the commands of the surgeon, dietitian, and doing their exercise on daily basis. So they accelerate the weight loss by that way.
Okay, so the weight loss is over months, it's not days or week, you mentioned.
Exactly. People, unfortunately, they are expecting to lose weight within a days after the procedure, which is completely wrong. Weight loss will be like a patient, if they stay like 3 months, they will find a very different weight loss comparing to pre-operative period. And when they just stay away from the surgery, they will feel that they are losing weight. And the good measure for that, if they measure their clothes, that when they before the surgery and they wear it after, they will find without even measuring.
Very interesting, Dr. Naif. Regarding what are the reasons for failure to lose weight? Is it related to the procedure or to the patient factor? So you can explain the technique. Okay, I think that's important.
Yeah, I think there is 2 ways. There is patient factor and there is surgeon factor. If we go with a surgeon factor, the problem, as I mentioned before, some of the surgeon who is not skillful, he's leaving some part of the fundus intact. So when he cut, he will go like this all the way and leave the fundus. The aim of this procedure to take the fundus away. If the fundus is still present or not touched, that means he's gonna get a weight, or sometimes he's not losing weight from the beginning. He will say he will lose like let's say 10 to 15 kg, then will stop, and then he will blame himself or blame the surgeon. But unfortunately, the surgeon is not cutting the fundus, which is the main aim of the procedure. The other thing that technique-wise, surgeon factor, some of the surgeons, they are leaving a big pouch. What's the meaning of big pouch? That means that the sleeve part start to be wide, as if he's not touching the stomach. He's using because we are calibrating the stomach and cutting over the calibration tube. So if he's using like 40 size French bougie or calibration tube, and he's making as well like 3-4 centimeters away from the tube. So that means patient will not lose weight. This is, I will consider it as a failure. Patient factor is he's not following the surgeon instruction, dietitian instruction, patient taking, because they were gonna feel like the easiest way to eat is taking chocolate. So chocolate is calories. So the calories that can be consumed almost very little. So they are not obeying the instruction of the surgeon and dietitian, and taking junk food and soft drinks.
Now we will move to non-surgical procedure like balloon, intragastric balloon insertion. Can you tell us more about this?
Intragastric balloon was one of the interesting subjects. People are afraid about surgery, and no one likes to go for surgery. So they will choose the easiest way and fast. Balloon is a great procedure. At the beginning, when it was launched in the 80s, it's as...
Dr.Naif, just how they do the balloon, عشان people just to understand that.
Sure. So we are going with the endoscopy.
From the mouth?
Yeah,
okay.
gastroscopy. So intubating the esophagus, then we'll go to the fundus and exploring the fundus all the way to the antrum and reaching the pylorus. Okay. As the first step is an exploration of the stomach inside to rule out if there is any inflammation, ulcers, or bleeding point.
Okay, yes.
So when it's done, we'll go back and bring the balloon and start to insert the balloon as we are inserting the gastroscope. And we push it with the stylus inside till we feel that it's almost inside the stomach. Then I push the gastroscope again, the same as the first time, and following the balloon. When I saw the balloon inside the stomach, then I start to inflate the balloon with normal saline that mixed with the methylene blue. The aim of methylene blue to be sure that if there is a leak from that balloon at any point of during the duration of the balloon inside the stomach, it will appear immediately in the urine. So the patient will have discoloration, green discoloration of the urine. So this is an indicator.
Good.
Then we inflate the balloon, reaching by like minimum 400 cc and maximum reaching 600. So the balloon will have like an occupying space inside the stomach. The aim of that balloon, decreasing the amount of the food and give high satiety period, as we are mentioning in the sleeve, but in different way. And that's it. Staying in the stomach for 6 months. Some of the balloon designed to stay in 1 year. The maximum weight loss up to like 25 kg in period of 6 months. Patient can exceed that number if they are, again, following the instructions and from the surgeon and dietitian.
Thank you, Dr.Naif. Now we'll go for a report about workshop on bariatric surgery. Please see more details on this report. Stay.
I'm Naif Abdulaziz, a clinical dietitian from King Saud University. Here in our corner, we are providing advices to each part of the family to have healthy snacks, healthy diet, a healthy lifestyle. For example, we are telling them to, instead of having chips for snacks, fast food, soft drinks, we are providing examples of snacks like nuts, popcorns, fruits, yogurt, milk, and that's it. Thank you.
Right now kids are like watching TV, eating snacks and eating like junk food. So what do you like to say to them?
Okay, we'd like to advise the families, the fathers and mothers, to take control, to control their children, control the time they spend on watching TV, on playing with their mobile phones, their iPads. Let them play. Let them just be kids. Just play their original games they used to play before that.
This is Omar from the Clinical Dietitian Department. Today, I want just to give you an advice that it's basic advice for nutrition management in life. Choose the smart food. Like what? If you want to eat fruit or juicy fruit, what's the better to choose? Actually, the better is to eat the whole juice, because when you eat the whole fruit, that you're gonna have fibers and the minerals and whole vitamin. But when you doing the fruit as a juice, you just get rid from other benefit things from the same fruit. Also, choose the better or the healthy fats. What do we mean about the healthy fat? We mean the omega-3, omega-6 fats. That is healthy. You can take twice a week, like fish, any sea product, and that's it.
Hi, I'm a health educator. My name is Fatima, and today I will talk about the benefit of water. Most of the co-worker here do not drink water that too much, you know. Most of them go to their break, drink soda or juices. So I'm gonna talk to them about the water and how it's benefits. Some people doesn't drink water, you know, they don't like drink water too much. So our idea is to mix the water with the some flavors. So we have lemon and mint, which has a good benefit, you know. So the lemon has vitamin C, and it's helped to increase the immunization, give energy, breathness will be fresh, and you know, they can lose weight when they mix the flavor or the fruit with the water. So this will help them to drink a lot of water as much as they can.
So right now you have lemon and mint. Yes. So it's really effective. Do you try?
Yes, it's so good actually. It's help, you know, to make them, because the water will, you know, absorb the flavor from the lemon and the mint. So they will drink more. It's not necessary to drink, you know, use this flavor. They can use, you know, any fruit like strawberry, orange, apple, any fruit they want.
Once again, welcome back to Elixir of Life, and we welcome our distinguished guest, Dr.Naif, العنزي consultant, bariatric surgeon. Welcome back.
Thank you. Thank you very much.
Now we'll continue the discussion. We have discussed the intraballoon gastric. What are the side effects, main side effects, and who is candidate for this kind of procedure?
To be honest, with the gastric balloon, is not that much side effects. It's very simple, easy. It's a 10 minutes job. The patient can go home immediately. The only that discovered side effect, as mentioned by the manufacturer, that increasing the gastroesophageal reflux, I mean increasing the acidity, they mentioned that can cause an ulcer or bleeding. Which is like 0.07, 0.05, which is very rare to happen. The only thing that can be happen is migration of the balloon to the small bowel, but still it's very rare. It's less than 1%. Yeah.
What about nausea and vomiting? Because we have seen some patients, they could not tolerate the balloon due to severe nausea and vomiting.
I think tolerance is different. It's individual variation between people. Because I saw some of my patients, they feel very easy, and they said, we don't feel anything, just like something inside the abdomen, inside the stomach, and discomfort. Otherwise, no. Some of them, they are very severe. They cannot tolerate it. So I brought them back to take the balloon out. Nausea and vomiting is only the period of like 48 hours and
transient. So it's just transient.
Exactly. If the patient be patient at that time and tolerate it with the medication, I'm sure it will disappear completely. So, you know, it's a foreign body inside the stomach. The body start to react and start to defense and need to take this foreign body out. And if you just tolerate, will be fine. With the medication, I'm sure it will be fine.
Dr.Naif, and who is the right candidate of this procedure?
If you remember, as we mentioned, that who's candidate for surgery is more than BMI more than 35. Here's the opposite. If anyone comes like with a BMI 34, 33, 32, so anyone below 35, he's a candidate to go for intragastric balloon. And BMI more than 28. So 28, more than 28, less than 35, any patient between this range, he is a candidate to go for balloon.
Dr.Naif, now we'll come to the take-home message. Do you think that bariatric surgery is necessity or luxury? Okay.
You know, you are asking a surgeon.
Yes.
So I think before that, obesity is a disease, and we need to know that and believe on this. Lifestyle should be changed. Behavior change is a must. And bariatric surgery is not the first choice, it's the last choice. But when you reach it, you need to do it.
Mm-hmm.
One sentence: stay healthy, you will feel the difference.
And again, important to follow diet, even after bariatric surgery.
Yeah. Diet is important.
Exercise.
Follow the instruction of your surgeon, follow the instruction of your dietitian, and I'm sure you're going to get the ideal weight soon.
Thank you, Dr. Naif, for enlightening us about weight loss surgery. It was very intriguing, discussion, and I did enjoy myself. Thank you, and we hope hopefully to see you again in our next episodes.
Thank you very much. It was a pleasure sitting with you and talking to the viewers, and I hope they enjoy the interview.
Okay, thank you. Now we are coming to the last segment of our program about health benefit. Let's see more details on this report. Stay with us. And once again, welcome back to Elixir of Life. We wish you enjoyed watching our episode and found it useful, informative, and inspiring for healthy lifestyle. Until next week, we wish you a pleasant week ahead, and our thanks and appreciation to our distinguished team headed by our director Abdullah Al-Wula'i, and prepared by Rahab Khalitit and presented by me, Dr. Muhammad Al-Shif. Assalamu alaikum. Goodbye. See you next week.